Assalamu alaikum, the communication day. First scenario, Mr. Ahmed, 55 years, known case of HOCM, hypertrophic obstructive cardiomyopathy, with history of inserted intracardiac defibrillator, presented recently with symptom. After investigations, it showed that his diagnosis of displacement of ICD. Your task is to discuss with him the diagnosis and address his concerns. Ready, Dr. Marwa?
Yes. Hello.
There you go.
Hello. My name is Dr. Marwa, one of the doctors in the clinic today. Can I confirm you are Mr. Ahmed, 50 years old?
Yes, I am.
Mr. Ahmed, we are here today to discussing some issues related to your medical condition. Is that okay with you?
Yes, doctor, please.
Do you want anyone to attend our meeting?
No, doctor.
Before start, can you tell me what you know about your medical condition?
Yes, doctor, I have heart problem since long time, and after that, do some battery inserted to help my heart. And now, in the last 2 months, 1 month, I suffer from the syncopal attack.
Yes, I'm sorry for your suffering, Mr. Ahmed. And do you know what is this device, or do you need to explain it to you?
Yes, doctor, I know this device, but I don't know why still I have syncope.
Okay, I appreciate your knowledge, and we are here today to explain you what is the result of investigation you did. It shows that this device is not in its place. It is placed from its site, and so he no longer work as usual, and for that you have these symptoms.
Why, doctor, the device is not in place? I don't understand, doctor. Why this happened?
This happened may happen to many causes, and now we're not sure about the cause of this. But it may be due to trauma if you're exposed to trauma, or abnormal sudden movement, or while you sleep, if you move in a proper way. Sometimes from start it is not fixed well in its place, and there is many reasons for that. But now we need to fix this problem, because if it is still and it is in the wrong place, it will make you risk of this syncope, or abnormal heartbeats, or regular heartbeats. Are you with me, Mr. Ahmed?
Yes, doctor. You mean, doctor, the error from doctor?
No, I don't mean that, but I explained to you the possible causes. We don't know what exactly happened, and we don't know what is the cause of this displacement. And now we need to admit you to do more investigations, and we need to fix this device in its place again.
No, doctor. No, doctor. I don't know what to do other surgery, doctor.
Can you tell me
Can
why
give
you
me
don't?
other treatment, medication?
I highly appreciate your concern, but I need to understand why you don't want to do this procedure.
No, doctor, because I did this procedure before. Why you want me to do other procedure?
Because now the device not work well. Now you consider not having this device, and you are need this device. We need to put it in this place and make it work well. to prevent the abnormal heartbeats result from your original disease. I think
There's any other there's any other alternative, doctor?
I highly appreciate your worry, Mr. Ahmed, but sorry to tell you that is the only effective method to prevent this abnormal beats from happening. Because this device, when it is present in its place, when it have a sensor, when it feel this abnormal beats started, it will give a shock to the heart and return it to its normal rhythm. Um, and there is no alternative to it.
Yes, doctor. How you can do a replacement this device? I can't understand, doctor, how to do.
Uh, it will be same process as the original one. You will be prepared before it, and we will enter specific special clean room, and you will be given some numbness medication, and a small
Mm-hmm.
incision will be done, and the wire which is connected to this device and connected to your heart will put in its place, and we will close again this side, and you will may stay a few hours to days in the hospital under observation to be sure that the device return to work again.
Mm-hmm.
Do you have
Okay,
any
doctor.
concern, Mr. Ahmed?
Okay, doctor. Doctor,
And
can give me time to thinking about that?
I'm sorry to tell you, time is very precious because we need to repair this problem as soon as possible because uh, any abnormal heartbeats, if happened, may make you at risk.
Yes, doctor.
Is that okay for you to do this procedure?
Yes, doctor.
Okay. In this case, we need you to sign a consent, a written consent. You will be read all these steps and precautions will be written,
Mm-hmm.
and also some complications that may happen will be written, and I will tell you about this now. You have to sign this consent, and if anytime you change your mind, you can do it. About the side effects of these procedures, as any procedure, you may feel pain, and in this case, you will be given a painkiller. You may be bleeding, and we will take care of this by giving you instructions to stop any blood thinner medications and follow up you by blood investigations, and also risk of getting bug infection. But with a sterile environment, it's very rare to happen. And also, risk of trauma, and our doctors are very expert in doing this
2 minutes
procedure,
left.
and very little to happen. All this will be written in the consent, and you have to read it carefully and sign it. Mr. Ahmed, can I ask you some questions?
Yes, doctor.
Social. Do you drive, Mr. Ahmed?
No, doctor.
Do you smoke?
No,
Do you drink alcohol?
no,
Uh, do you, anybody depend on you in home?
with my wife.
Now you are living with. Uh, is he or is she or you need any kind of support,
No, doctor.
either financial or
No, doctor.
uh, okay. I will give you also some websites and brochure about this procedure to read more
Mm-hmm.
about it before doing it, and our contact number if you need any uh, clarification, you can contact with us.
Doctor, I have concern. Why no anyone to tell me about this can happen regarding displacement of this device?
Uh, I'm sorry that no one tell you that maybe happen, but it should be um, inform you at the beginning as a possible complication of this procedure.
Okay, doctor.
Do you have any other question?
No, doctor.
Okay, time is up. Well done, Dr. Marwa. Perfect. Let's hear the comment, Dr. Rasha, then I will comment.
Okay, Dr. Marwa, well done. But I have some يعني comment regarding this scenario. The displacement of ICD, one of the complication. For that, you need to say to the patient, this the one of the complication can happen. The other thing, يعني not say to the patient, this the one of the complication can be happen is not rare يعني. The other thing you need to focus in the patient is the serious to do this the procedure, because if do not this the procedure, patient now have suffer from the syncopal attack, patient may suffer into the arrhythmia and life-threatening condition. I think you need to stress more about the patient to do this the procedure, and say to the patient is the important to do the procedure, and also say the patient if not do this the procedure may be life-threatening condition.
Yes.
Yes, explain the procedure before and after and during. But regarding this the scenario, because the patient was inserted the ICD before, you need to say to the patient to do the procedure into the same side, but after the open the window, open the window under the clavicle, need to remove the old device and inserted the new device in place, and work this the device to make sure this the device is working, and after that to do the suture and close the window, close the okay. Okay, after the
General
procedure,
or local anesthesia? General?
I think in the locally anesthesia you need to open.
Local, yes. No need for general.
Yes, local. No need to open. Disconnect the old device, remove, and put the new device in same place. And after that, work the device, and after that, close the suture. And clinical advices the same after procedure, the same complication, bleeding, and after that anola. But there's have the specialized team consent, need to insert other consent, and not ask me about the job. Patient in this the scenario, football player.
Mm.
Okay, but overall good.
Your last concern, how to answer it? About not telling about the side effect.
Okay, if the patient there's no anyone inform about the side effect, is no anyone inform about the procedure, make it as medical error. You said I apologize, if no there's no anyone inform you about the one of the complication like this, because if the patient is not informed about one of the complication, you take it as medical error, but not do all the steps of the medical error. Just only apologize of the patient. There's no anyone inform you about this the one of the complication that can be happen.
Thank you.
Yeah, thank you, Dr. Rasha.
Welcome.
Yeah, thank you for the scenario. Well done, Dr. Marwa, by the way. Again, I said it before, Dr. Marwa, you know how to communicate and you have the skill of communication. So you know the scheme of this task, what to do. You inform already, you explain, and the action, the new insertion, the seriousness of being without ICD, you inform him about it. And he asked about also alternative. You didn't advise for the alternative. You insist to insert another ICD, which is the task. Let's go for the error. Yes, I agree to say apology or to apologize for once, but you can add one sentence. I prefer to say it whenever you have medical error, which is not usually happen. So you can add, we used to inform in our practice about this complication might be possible. So in this, by this way, you really apologize and you try to convince that it might happen, even if it's not happen. If it happened without informing you, means there is something which is rare to happen by us. But we used to inform our patient that this complication one of the possibility. And please mention it again in your scenario while inserting or reinserting the ICD again. So you can say about the pain, the bleeding, and about the injury to some blood channel or to the heart itself. Again, you can mention, yes, it's possible again. Yeah, it might happen again. I'm so sorry to say that. So please be careful. Avoid some strenuous exercise. You can read about the precaution, the instruction, how to maintain this ICD in place because his job is at risk. He's a football player, professional football player, so he might be at risk again to happen. And don't forget other safety netting regarding keeping the patient away from magnetic field and some CT or some image should be avoided. Before doing this image, he should inform his doctor. This instruction, like complementary, something to get or to get the full mark. Otherwise, you cover the whole scenario well. You explain what happened to him, the expectation. You didn't ask about expectation, but better to ask to know what is in his mind. The also explanation why it happened, the possibility. You give some causes, a reason, what happened exactly, why it's displaced. Yeah, the causes you don't know, so you guess, and your guess was really makes sense. What you give, like trauma, or maybe you carry or you lift heavy object. All these reasons might be the cause, but we don't know exactly what happened. You can explore to him, but don't take history. Take care. Don't tell him. You can tell me what happened exactly with you. If he give to you if you ask this question, so you might be as taking history. So the best way is to explore, to give him some reason, some examples. Sometimes our patients had a trauma. After trauma, they have this displacement. Other patients carry or they lift a heavy object. After that, they came to us with this displacement. So far, you didn't take history, and you don't know exactly what happened, and you want to ask the patient to open up and to tell you. He might tell you, yes, doctor, I had trauma last week. It might be the reason. Yes, it might be. Okay, but don't take history. This is the point I want to stress on because you did it in perfect way. The last thing, the job. I don't know how you missed the job. It's very important. You ask with whom you are living. You ask who's dependent on you. The smoking, the alcohol, the driving, which is also perfect. You have to address the driving in this scenario. ICD after insertion. I remember, I think 2 days, right? After reinsertion, it
One
takes
week.
1 week or 2 days. I remember something was 2 days. I don't know what was the 2 days for some procedure also, ICD or something else. 1 week for PCI, I think. But ICD,
Mm.
I can remember 1 week. We can recheck again. Anyway, you can tell him, please stop driving until we will tell you when to drive back. And you can offer him also someone to drive you home. It's very important to ask this question. Do you need someone to take you home after this procedure? You mentioned the monitoring after the surgery, which is important. The consent form. I think you covered the scenario in perfect way. You can get at least 2 marks minus for the job only. Otherwise, you get everything. You want to ask any question, Dr. Maro?
No, thank
Dr. Rasha, any point missed by me and you? You want to add
Uh,
any suggestion?
yes, but I want to ask if to say if the patient football player you needed to change the job
you.
I
because the
believe,
patient who come you need
yeah,
to
I
refer it to
believe
occupational health.
exactly. This is the best answer. You don't know, right? You are not sure. Is it to avoid, to prevent? You don't know. So the best way is to refer him to the occupational worker. They will address it, or the heart doctor. He will tell you, is it suitable to continue in this job or no? But
Yes.
I believe it might be prohibited to practice or to do a professional football player. But you don't know the rules. By the way, if you hear some stories about one player had cardiac arrest in the theater and he resumed his football player as a professional. I know his name, by the way. He has something related to his heart, arrhythmia, and he had cardiac arrest. They did CPR during the match, and he resumed his activity as a player, professional football player. So you don't know, and I don't know what's the rules regarding HOCM and football. If I tell you, I know, I think it's falsafa. So the best thing to refer him to the heart doctor and to the occupational worker, either to address or to refer or to let him do whatever. But this is not our job. Clear?
Yes. Yes.
Okay. Any other point you want to ask or to add? Any question from others before moving to next scenario? Dr. Marwa, please, you can write your scenario for Dr. Rasha.
I sent photo. It's a
You
photo.
sent already? Perfect. Okay. 1 month of prophylactic ICD. 6 months for arrhythmia group 1. Okay, this is Dr. Ihda. Thank you, Dr. Ihda. So what I talk about, it wasn't ICD. Something, pacemaker maybe, yes, pacemaker. I think pacemaker, not ICD. ICD is something fatal. I mean, it's prophylactic for either non-sustained or sustained VTAC. If for sustained VTAC, it will be longer, but if prophylactic, it will be less. So thank you for the correction, Dr. Ihda. My 2 days was about the pacemaker, not about the ICD. Okay, your scenario, Dr. Rasha.
Yes.
Miss Layla, Mrs. Layla, 55 years old, known case of diabetes and hypertension. She had been complaining of severe headache since yesterday night. CT brain done for her and diagnosis of subarachnoid hemorrhage was confirmed. You are the senior house officer of the neurology department on call today. You have been asked to discuss the result and further concern to her. 2 minutes, then we can start.
Okay.
Okay, one week for pacemaker, right? Indama, sorry, not Indama, in the DVLA. Any patient, if you are not sure about the duration, don't give frame time. Just say, we might avoid driving till further assessment. This is the best way how to address. If you remember the duration, okay, you can mention. But if not, please don't give wrong information. As I did, I said 1 week, then 2 days. This is a mistake, big mistake. So the best way if you don't know, don't give specific or particular duration. Just say, I will reassess, I will refer you, or I will ask my senior. Or if you want to be safe, tell him, I will, we will stop driving until further assessment. After that, you can resume your driving if it's suit for you or if it is safe for you, for your safety. And for your safety as a doctor also. Yeah. To get a mark, don't mention something might be wrong. Okay? This is the best way how to address any duration. Driving or even for driving and, for example, screening or flying in the flight, resuming a job as a pilot or any job. If you're not sure, just give him unclear or just tell him we will reassess you back. If you are okay with this, we will let you know. Dr. Marwa, you ready?
Yes.
Yeah, here you go.
Yes, okay.
Gosh.
Sorry, Dr. Rasha, I should be the one. I can't. Sorry.
Yes.
You're ready, Dr. Rasha? Or you want
Yes.
one more? Okay,
Yes, yes.
here you go.
Hello. Uh, Hello, my name is Dr. Al Mahdi. I am doctor in nerve clinic. Can I confirm I am talking to the Mr. Layla, Mrs. Layla, 55 years old?
Yes, I am doctor.
Uh, Mrs. Layla, we are here to discuss about your health condition. That's okay with you?
Yes, okay, doctor.
Do you want anyone attended to our meeting today?
No, doctor.
What do you know regarding your condition?
Doctor, yesterday I have a severe headache, and I came to hospital and they gave me some medication, and I feel better now.
Mm-hmm. I am sorry for your suffering. What do you expectation from our meeting today?
I expect that you will give me some painkiller and I will go home.
Mm-hmm. Well, Mrs. Layla, as understand you, you came yesterday with suffer from the severe headache. Some imaging for the brain was done for you. I am afraid to tell you that the result of the imaging as not as the imaging of your brain as not good.
Why, doctor?
The imaging of your brain that reveal you have a condition is the called subarachnoidal hemorrhage.
What you mean, doctor?
Have you ever heard about that before?
No.
Do you want me explain more?
Yes, please, doctor.
Uh, well, a subarachnoidal hemorrhage, that's meaning there's blood into the layer covering into the brain and spinal cord, leading to the symptom that you have like severe headache and sometimes leading to the weakness. Um, for that, what we need, are you follow me?
Yes, doctor.
This subarachnoidal hemorrhage may be related to the underlying, may be related to the other, may be related into the background high blood pressure or related due to the high blood pressure. And what we need to do now, need to admit you and okay, needed to admit you and keep you into the under the our under the close observation under the our eye, and to start it into the some medication needed to the control needed and also to control the blood pressure, and also needed to start the medication to help you regarding your condition. That's okay with you?
No, doctor, I want to go home. I can't stay.
Uh, uh, Mrs. Layla, your concern is understandable, but before address your concern, can ask you why you want to go to the home?
Because my kids in home are alone. Nobody take care of
I
them.
am sorry.
I need
I
to
am
go
sorry
home.
about your kids, but let me explain more. Before your condition is still now is not stable, For that, we need to keep you under the close observation and under our eye, and also needed to start the medication to help you regarding this the blood. Regarding to your kids, we can contact to the social worker, and also you can contact to the family member to help to care about him, and also we can help you by refer to the social worker to help you regarding this the issue. How does that sound for you?
Doctor, I feel well now. I want to go home. I have also my work and my family. I don't want to stay here. I feel
Uh,
good.
mhm.
I am feeling good.
uh, um, your concern is valid, but your condition is still uh, is not uh, is not stable. For that, you need to keep you under the close observation, and when we feel your condition is improved and there's no any is improved, and after assess you, we can discharge you at home. But until now, you need to keep you under the close observation.
Doctor, I know myself. I am well and good. Give me only painkiller. If this headache return again, I will take it and let me go.
Well, Mrs. Layla, regarding to your condition, this the headache is related to the blood presented into the layer on the brain and layer of the brain. There's the regarding your condition, the painkiller. There's no rule to treat your condition. For that, you need to start some medication. And keep you under the close observation, because sometimes your condition may be deteriorated depending to the amount of the blood, and sometimes maybe this the blood is resolved. For that, you need to keep you into the under the close observation to follow your condition.
Doctor, I hate staying in hospitals. I want to go my home. I don't want to stay.
Can ask you why you hate into the hospital exactly? There's something is hate you, something is annoyed you.
No, no, doctor, but I feel I don't feel comfortable in hospitals in general. I want to go my home.
Mm-hmm. Well, Mrs. Layla will be arranged to the other meeting to our consultant to discuss with you about the issue. That's okay with you?
When will be having doctor? Today?
What?
Today, this meeting?
We arranged to the other meeting to our consultant to discuss with you about your condition and discuss with
Okay,
you
doctor.
about. Mhm.
Okay.
Do you have any other concern?
No, doctor.
Uh-huh. Can ask you some questions.
Okay.
Uh, what are you do for living?
I'm a teacher.
Uh-huh. How much this is okay. Do you smoke?
No, doctor.
Do you drink alcohol?
Yes, occasionally.
Uh-huh. With who you live?
With my husband and my kids.
Uh-huh. With who supporting you?
My husband.
Okay. Do you drive?
No,
Uh-huh. Okay. Uh, okay. Do you have any other concern?
I don't. I have concern except that I want to go home.
Mm-hmm. Mrs. Layla, there's something you to keep you to go to the home.
I told you, doctor.
What?
I told you.
2 minutes
Mm-hmm.
left.
Yes. Regarding to the your kids, we can help you. You can ask one of the family member to help you regarding these kids, and also we can help you by contact to the social worker to help you regarding this the issue. There's any other thing you want to go to the home?
No, as I think only this.
Okay, Mrs. Layla, and also I will be give some leaflet and brochure to read more about your condition. And if you have any query, please don't hesitate to ask me, to ask us. That's okay with you?
Okay, doctor. Thank you.
Okay.
Still 1 minute left. Do you want
Uh-huh.
to add any
I think
advice,
mhm.
instructions?
Instruction, the patient is not to drive. Patient is not to drive.
Yes.
Not only driving,
Instruction about what?
what the condition? Subarachnoid hemorrhage.
Yes, but
The
patient needed to
complication. Yeah, the
yes,
complication.
yes. Complication, yes, like weakness, but patient needed to keep into the hospital, I think.
Yeah, I
Mm.
agree, but she didn't agree. And maybe something serious, you should tell her. She might agree after that, right? What do you think?
Yes, because if the bleeding may be increased, and also maybe her condition may be deteriorated, for that need to keep you under our eye.
Okay.
I tell her regarding that.
Yeah. But you didn't
Uh,
tell particular complication. Even you didn't tell her the most serious complication. What could be the most serious complication? If patient having subarachnoid hemorrhage, what complication might threaten his life?
like what?
Like coma and death, right? Is it possible?
Mm-hmm.
Herniation due to increase intracardiac pressure, herniation, coma, death. She might be afraid if you tell her like anyway.
Permanent
And that time
paralysis.
is up. Yeah.
Yes. Mm-hmm.
Okay. This time for Dr. Marwa to comment. Then I will come.
Mm-hmm.
Dr. Rasha explains subarachnoid hemorrhage, but the point in this case, she insists for discharge, and in
Mm-hmm.
this case, we should assess her medical capacity and refer her to the neurologist who will assess the medical capacity because the subarachnoid hemorrhage may affect the medical capacity, and if it is incompetent, will be retained in hospital under mental act.
Mm-hmm.
Um,
Yes. Mm-hmm.
and also, as what Dr. Bassem said, will uh, inform her about the complications and if also if she has the medical capacity, will inform her about the red flags. If she feel any weakness, any change in her consciousness, her awareness, she will return back again immediately or contact the hospital. Just this my comment.
Yeah. Thank you, Dr. Marwa. Any particular advice regarding her kids you want to say? Anything
Uh,
hidden in this scenario? I mean, anything
no,
hidden?
no, no, no hidden, but
Okay.
this point of mental capacity.
Yeah, I agree with the solution Dr. Rasha already offered. But please, before offering social support or social worker, try to advise to find someone, her family member, to sit with her kids, or you
Yes.
can offer.
Yes. Tell her
Yeah,
family
yeah,
member.
I know.
We can.
Yeah,
Okay. Mm-hmm.
yeah, I'm just repeating. So the
Okay.
first option, family member, friend, neighbor. If not, if not available, so we can refer or we can ask a social worker to support her kids or to give us a solution. Otherwise, yeah, you explain already the condition, but I preferred to explain the seriousness of the condition. By the way, they are stressing on this and the feedback. Any patient having a condition and you want to make the patient convinced to stay at hospital, they need from you to explain the most serious complication, and it is real. You're not saying something none or not in reality, right? So when you mention the bleeding exceeding or extending bleeding, or when you mention it might have stroke spasm, I mean vasospasm, complicating the condition. And sometimes the brain pressure will be increased to the extent you might be in coma and you will not feel anything up to death. If you said all these things or the complication, and which is also real, in fact, it happened. Maybe this patient will go home, yes, with the medical advice or against medical advice, but she might come back as brain herniation and coma, and you'll be the one responsible. You didn't explain the seriousness of the complication. You just said, yeah, something might happen. We are worried about you. But you didn't tell what is the possible complication, which is life-threatening one. Please remember how to explain the seriousness of any condition. Any condition, not only this scenario. I mean, in any scenario, you want to convince a patient to stay at hospital and to admit the patient, and she's refusing. Try to give her the seriousness of the condition. If she's agreed for staying, it's okay. If not, you can arrange a meeting after addressing her concern, or at least you can sign DAMA. But if you are confirming that she's having the capacity to decide about discharging hospital or discharging home, leaving the hospital and discharging home. Is it clear, Dr. Rasha?
Yes.
Yeah, but
Yes.
you did great. You didn't you tried to address the concern, to explain why to should stay at hospital and why shouldn't go home. You tried to address and to find a solution for her kids, but only remember the explanation of the seriousness of the condition. The
Yes.
expectation, the introduction, everything was okay. I agree. You can get a good mark in this scenario or any communication scenario. You know how to address.
Yes, because when thinking about the scenario clinical in the
Yeah.
hospital, not all the patients subarachnoidal hemorrhage have complications. Some of patients, small amount,
Yes,
we can,
of
yes.
course.
For
Yes,
this,
of
يعني,
course. I agree. But if the complication habit, you will be in trouble. The
yes,
complication, the vasospasm itself, it might lead to something permanent weakness. For example, patient might have a stroke, and I saw such patient. He came with subarachnoid. It was complicated by the vasospasm, and the vasospasm leaves the patient as residual weakness or hemiplegia. You don't know what will happen. So you have to admit to monitor. As you said, we will
yes.
monitor to prevent the complication from happening. But you should
Yes, so
explain the
serious,
most
yes.
serious, yes.
Yes,
So the
to
patient
convince
might,
the patient to stay,
exactly,
yes.
yes. But if she insists, as Dr. Marwa said, and you felt she's unconscious or her capacity is affected, you can refer her to the assigned team, either mental health act or a neurologist according to your scenario. But try to convince your patient. Regarding the underlying cause, you mentioned hypertension, which is not clear that it is related to hypertension.
Yes,
Yeah,
yes.
you try to, but you can say, for example, but don't say it's related to your hypertension. You don't know what the reason. They
Yes,
might say that you are inventing, you are saying something which is not in the scenario.
is
You
not,
don't know.
yes, صح.
Yeah.
Mhm.
So either to say, we will investigate to know what the underlying cause of your condition, because it's not written because of this subarachnoid hemorrhage happened because of hypertension. So we might admit you to know what the reason. It might be a aneurysm, and if this aneurysm still
Rupture.
exactly, it might
Mm.
be complicated with rebleeding, and the rebleeding will be more serious. So according to the underlying pathology, you might admit or not to admit. You have to remember when to say the underlying cause and when not to say. In this condition, don't mention something which is not mentioned in this scenario.
Yes, yes, not
Okay,
need. صح. Mhm.
not need, and it's maybe it's wrong. Maybe it's wrong.
Yes.
Yeah,
Mhm.
wrong explanation. It might be something else. She's young. She might have
Yes.
another condition, maybe a AV malformation or aneurysm. You'll be in trouble if it is the reason. And you mentioned something which is not related, maybe the blood pressure control. So don't say something which is not mentioned in the scenario. Okay?
Yes. Okay.
Any other question or suggestion? Any doubt, Dr. Rasha?
No.
Any
Yes,
question?
but I
Yes.
think yes, as the hidden agenda, forget in a patient, you must check the patient competence.
You
Yes,
can check it,
capacity. Mhm.
earlier if you ask for example, what day today? Do you know where are you now? Even person, you can ask her how many kids you have, just to show the examiner that you are checking the capacity. But when the patient tell you about her background and what happened exactly and the expectation, I guess
Yes.
this patient is having good capacity.
And also
Okay.
ask the patient, are you getting me? Are you following me? The patient has
Exactly.
to
Yeah.
say.
Exactly. I agree. And in the scenario, I think the task, you are the senior house officer in the neurology. So how to refer her to the neurology?
No, not
So
referral. I said admit, not said referral.
no, Dr. Marwa said you
Uh,
have to refer the patient to neurologist, and you are the neurologist.
Senior house officer, I think, not a
in
specialist.
neurology, yes, neurology department.
I, yes, but not a specialist.
Anyway, I think this patient is having good capacity by repeating the information, digesting the information, and also understanding what's ongoing. But if you want to add one more question at the end, you can ask about the time to know if the patient oriented, or to ask the patient to recap.
Recap,
This,
yes.
yeah, this is one. This scenario, one of the scenario, you can ask the patient to recap what happened exactly between you and him. So if she can recap and she tell you everything and the decision, and you feel she is having good capacity, yeah, this time you can discharge her. But don't forget to offer DAMA paper. But please,
Yeah.
before deciding for DAMA, let her sit with the meeting, or sit here in a meeting with a hair consultant, or your consultant. Okay.
Okay.
Any other point, Dr. Marwa?
No, I don't have ideas.
Okay. Thank you for the scenario, and thank you for participation today. Any suggestion or doubt by others or from others? Any added points? Any suggestion? Yeah, I have some comments here. Dr. Ihda, why refer her to neurologist? And you are exactly, this is what I mentioned. No referral here, Dr. Rasha mentioned, yes. So it's your task. It's not referral. It's your task to sit with the patient as neurologist. So you cannot tell her, I will refer you to the neurologist. You are the neurologist. If you want to say, I can arrange a meeting with my consultant or my senior, he's in a better position to explain to you about your condition and the importance of being in the hospital. Dr. Hatem, can we say to the patient, we cannot allow you to discharge as we need to assess your mental capacity before? No, I don't think it's this sentence makes sense if you mention. So if you mention that, she will tell you what you mean, doctor, because you are doubting about her mental capacity. She will understand from this sentence. She will tell you what are you saying, or she might say it's something bad. What are you saying by this word? What do you assault, or do you assume that I don't understand? So it's not making sense to say this sentence. How we should assess the mental capacity in communication scenarios? Good question. Again, in the introduction, you can ask her to repeat her name and age. If you suspect the capacity is affected, before starting the scenario, you can ask her about his name or her name and the age. Adding to this, you can ask her what the day to day. So you are asking about orientation to the time, and you can ask her also which hospital you are in. So you will be asking for the orientation to the place. In between, you can ask her, are you following me? Do you understand me? You can add the question for with whom you're living. So she will tell you my kids. You can ask her about her kid's name. So this is another question for orientation to person. So the 3 points now, or three items for orientation: time, place, and person. And at the end, you can ask her, can you recap for me what exactly have been discussed between me and you? So this is the way how to check and to examine, or how to confirm if this patient is having good capacity or she lost the capacity. By this way, you can do the capacity examination. And you
We can
have
tell
to,
the
yes, go on.
okay. We can tell the patient before your discharge. We need you to meet our consultant to assess your condition more.
Yeah,
We,
this if the patient is insisting and you want to
mm,
convince, but she's asking how to check the capacity.
uh, we I think we will not check the capacity. The neurologist
No, no,
told
no.
me
There
the
is no, no, no. There is scenarios, by the way, Dr. Marwa.
mm,
It came before to check the patient capacity if he can be or she can be discharged home, or even
mm,
capacity in general about decision to insert something or to do procedure.
mm,
For example, motor neuron disease. They will ask you to explain about NGT and to check his capacity. Is he able to decide which option for big tube, for example, or NGT, he can decide for it, or he needs
take
someone to take
decision.
a decision. Exactly.
Mm,
So it's not only the neurologist or mental health team. It's your task as a
mm,
physician. So you have to be ready for these scenarios. But what I mentioned already, this is the way how to check for the capacity. To ask
yes.
about orientation, and at the end you ask the patient to recap, and in between during the scenario you can ask if he's understanding, if he is knowing what you are telling. All the things let you know if this patient is
Time,
having good
person,
capacity
place.
or not. Yes, exactly.
بس إضافة بسيطة.
Yes, Dr.
الستبس الله يسعدك، الستبس الثلاثة اللي أنت حكيت عنهم اللي هي تشيك الأورينتيشن at the beginning، وحتى to ask the patient every now and then whether he agree with you and he's able to follow up, or he want you to repeat anything. لأنه طبعا if he didn't understand and he ask you to repeat, this mean that he have a capacity. بس أهم خطوة بين هدول الثلاثة، let's say إنه يعني you forget ولا you missed ولا أنت at the end وقالوا لك 2 minutes are remaining، فشو الخطوة اللي you can save yourself especially لو كانت procedure أو patient demanding discharge أو patient non-compliant وقال لك 2 minutes remaining، you will lose the scenario if you didn't do this step، بالذات بهدول الثلاثة. if the patient demanding discharge, if you are discussing a procedure, or if you are talking about compliance. recap يعني if you did a recap at the end when the 2 minutes are remaining, you saved yourself. لأنه الريكاب بكل السيناريوز is a closure. لحقنا عملنا، ما لحقنا ما عملنا. لكن in this scenario it is part of the judgment. يعني أنت you are not just يعني it's not a part of communication إنه I have to have a proper closure يعني to end the scenario. It's a part of the clinical judgment. لأنه for the procedure the first thing to sign a consent is to have a full capacity, and you have only like يعني you want to fulfill this لأنه ما عاد صار في examination question. من أول كان في examination question, at least the examiner will ask you what is the element of the consent, you will tell capacity. okay, هلا there is no examiner question, so if you didn't ask the patient to recap you missed one of the element of the consent. Well, consent is part of the clinical judgment in any procedural scenario. Non-compliant, and if the patient is not taking the medication, before I convince the patient and to understand why the patient is not compliant, and I should understand whether he have a capacity, to make him understand the risk versus benefit. And I can discharge him hoping that he will listen to me and will be compliant. تمام؟ فهي البروسيجرال والكومبلاينس. شو ثالث سيناريو قلنا عنه يلي كمان أنا نسيت من 3
suicidal.
السويسايدال أنت مرتاح. If you didn't any recap you are out of it، لأنه أصلا المنتل health team are the people in front اللي هن بواجهة المدفع، هن يلي لازم يعملوا شيء اسمه formal. يعني بهالسيناريو فقط مطالب الهيلث كير بروفيشنال أو الفاسيلتي إنه يعمل formal mental health assessment و formal capacity assessment which need a specialized team. ما بيقدر أي health care provider يعمل هالخطوة in suicidal attempt. تمام؟ لكن بالبروسيجر patient demanding discharge كمان patient when he's demanding discharge at this point إذا ما في mental health issue you are as a doctor أو healthcare provider you can assess capacity. So whenever patient is demanding discharge وقال لك أنا I want to leave the hospital, I'm not even ready to meet your consultant, at least 2 minutes remaining, please tell me whatever you got from our meeting and whether you understood the risk you are putting yourself in case you left the hospital without completing the treatment. هيك أنت رفعت مسؤوليتك حتى لو ما ناديت الكونسلتنت because even if you didn't call the consultant because he don't want to wait, your consultation is safe. You are in front of a patient who is competent. The patient demanding discharge procedure will compliance plus suicidal, there is an extra step you should call mental health team. بس recap very important step in those scenario whenever you hear 2 minutes remaining. newly مع 10 minutes صرنا كتير ناكل خطوة الريكاب، يعني we don't do it too much. بس in these 3 scenarios يعني you might lose your judgment, you might really lose your scenario. For 2 minutes remaining please recap for me. Can you we discussed a lot. حتى لو بقيان points you want to complete بعد ما يخلص الريكاب you complete your scheme or your agenda. بس يعني it is very important in these three scenarios. وما حتكون جزء من الكلوجر، حتكون جزء من الستبس تبع الكلينيكال judgment to confirm he is having capacity. بالإضافة للستبس اللي قالها دكتور باسم الله يسلم إيديه in the beginning of the scenario. طيب how to assess the capacity in patient when you are talking to a relative وما مكتوب بالسيناريو whether the patient is retaining his capacity or not. وانت you want to have an idea whether the patient have capacity or not. مثلا in order not to يعني بدك توقع الكونسنت، فمثلا it's a procedure you want to know whether you will go back to the patient and talk to him ولا whether you will tell in the beginning that you already took a permission from the patient. فما بتقدري تقولي هالعبارات إلا لو أنت عارفان البيشنت عنده capacity. Otherwise if you don't have a capacity and you said something like we took the permission of your dad يعني you will appear like يعني ما حيكون it will not be a valid sentence. how we will ask about the capacity indirectly from the next of kin. هيك صعبناها شوي but it's a valid thing to discuss since you opened this issue يعني.
You mean you want to ask the relative?
ايه عندي relative.
Yeah.
وأنا مو
and
مطلوب
in this
صراحة
way,
ايه.
you want to know if if the patient is having good capacity or lost.
يعني you are talking to the son والfather is a Parkinson أو advanced dementia. هلا لو advanced dementia أنت متأكد، بس مثلا لو Parkinson MND يعني you want to know whether the patient is still competent or not. how you can ask or get a clue about the competency from the relative.
But by this way you can ask like taking history, Dr. Hind. You mean
هلا أنت
a
ما دام عم
question?
تسأل على الكاباسيتي it's not taking history. You will just ask him when was the last time you met your dad and he was in a good condition.
Okay.
How
But
is
it
your
will not
dad
consider
when you
as
met
taking
him the
history.
last time.
Yeah.
بس فهو انت كأنك حتى عم تسأل عن الكونديشن، فكأنه welfare question، بس بنفس الوقت عطاك extra clue انه yes my dad was fine and he was asking when he will be discharged. اوكي معناتها he is. هلا هي it is not a definite، بس يعني at least إذا السيناريو was very vague you get a clue. It will give the examiner إنه you are a professional person, you are seeking this information from the relative. تمام؟ إنه how was your dad when you met him the last time? How was he? How was your discussion with him? فهي will بقى حيحكي لك جزء من مثل لما بتقابل patient وبتسأله how you are doing, how you are feeling. تقع نفس الموقع not history. و at the same time it will give you a clue. تمام؟ فهي الطريقتين مشان نعرف الكاباسيتي from the patient himself و from the next of kin. What are the scenarios where asking for recap is mandatory as a part of assessing capacity. تمام؟
Yes, clear now, Dr. Hind. Thank you.
الله يسعدك يا رب.
Yeah, I think now the question for capacity is very clear with good details. Anyone want to review, he can listen to the record again to know more about the capacity. Any question from others? Thank you, Dr. Hind again, and Dr. Rasha, Dr. Marwa. Any questions? Any questions? Sorry, I have some noise around here. But anyone want to ask question, please let me know before ending the session. So it seems clear for all about the scenarios today and the capacity point. It's very important, by the way, Dr. Marwa. Don't go in exam or an exam without knowing how to assess the capacity. It's one of the tasks. It might be asked during this discussion. And they can assess you without asking, as Dr. Hind mentioned. They will ask, not ask, they will assess without asking you. Before they can ask you a question after finishing the scenario, how to assess the capacity, and you can answer according to the ethical and legal and blah, 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 blah. But nowadays, in the new format, no more questions. So whatever you are practicing and doing, they will assess and judge on your performance. Okay?
Dr.
Yes, okay.
Okay.
Dr. Basim, I have a
Yes.
question.
Yes, Dr.
Regarding
Rashid.
the capacity, you need to ask the patient about the time, person.
Yeah, you can, yes.
But if ask about this patient, about the time, person, as ask the Glasgow scale,
No,
orientation. يعني.
No, orientation only, not Glasgow. Glasgow means the patient coma
Yes,
or
you
not
mean
in
ask the
coma.
patient about the time person or time will person.
Yes, and at the introduction, you can ask him, how are you? How do you feel? What the time is
Yes,
now?
how are you feel? Ask in the introduction,
No.
ask the how
Yeah,
you feel
I mean,
today.
as an introduction, then ask about the time. Do you know what the time now? Do you know where are you now? Because it's a clear task to check his capacity. And how you can check capacity if the patient is already lost or he doesn't know where is he or where is that, what is the time now? Is it daytime? Even at least you can know from him if he knows this is the daytime or nighttime or evening time. Simply, if the patient lost the time or sense of the time, this patient already lost the capacity, right? So why I waste time to ask more? If he lost the capacity, but it will not happen in the basis, by the way. They will not give you patient lost the capacity, but they want you to assess the capacity. How to assess the capacity? By these questions. Clear now, Dr. Rasha?
بس
Yes,
أحيانا هذا
بس
السيناريو
أحيانا yes.
هذا
Wait.
السيناريو بس عم يحكي دكتور باسم على السيناريو your task لأنه في عندك بالآيرش 6 minutes so they can give you a pure task in the scenario just to assess capacity. يعني من السيناريوهات المتعارف عليها بالآيرش إنه the patient is for ICD insertion. تمام؟ sit with the patient and assess capacity. بعد ما طلعوا كل الكانديدات ما أغلبهم ما نجح بالكيس لأنه أخذوا الكيس على إنه ICD counseling procedure scenario وما انتبهوا إنه التاسك تحت ما له counseling about the ICD كان the task assess the capacity. فأنت you want to assess the capacity in order to counsel the patient about the procedure. بهيك سيناريو كلام دكتور باسم ما يعتبر history، لأنك أنت you are doing this as a part of your task. هلا امتى ممكن يكون في، يعني امتى ممكن تحسي انه في حرج بسؤال بهيك اسئله؟ لو your main task is not to assess capacity، لكن ال assessment of the capacity is the hidden task inside your task, which is a procedure، ولا manage the compliance issue، ولا convince the patient not to be discharged. اوكي، يعني ممكن تسأليهم in one question أو you ask one question rather than all the three. تمام؟ أو مثلا how do you feel and where you are now, I'm sorry for letting you wait for a long time. يعني to make it in as a part of just like a good introduction. بس إذا كان التاسك تبعك 100% تحت مكتوب it came in the exam, especially for the 6-minute Irish exam, your task is to assess the capacity. So then you can ask about orientation, you can do recap every now and then، ما بتستني لآخر السيناريو، لأنه your task is to assess capacity. بس هذا very rare in our exam cases، بس is common in Irish exam.
Yes,
تمام؟
yeah, you're right, Dr. Hind. It happened in Irish, but why not? It will not. It might appear in
يعني
our.
طبعا،
Yeah,
فأنت بس إنه
exactly.
يعني شلون بدي أقول لك you just look at your
Yes,
scenario and do
exactly.
things in introduction، يعني as if you are having a good introduction. تمام؟ والrecap is the most important step. This
Exactly.
is don't
Yes.
forget it. If you have a good patients، يعني not angry patient، مثلا أغلب الأحيان ال patient who's refusing treatment demanding discharge will not give you a chance to have a good introduction. فأوكي if you skip the question about the time and person, it's fine, you will do recap at the end. But if the
Exactly.
things are good and you had a chance to do a good intro،
Yeah.
خلاص ask
Do
them
it.
in the beginning.
Yes. Yes. Clear now. Yes. Is it clear, Dr. Rasha?
Yes, ask, you mean ask the beginning, the time, will place,
Yeah.
person.
Yeah. If you feel this question doesn't make sense for the patient and you felt he's angry and he will not accept such questions, skip it and
And
try
keep
to
it
ask.
for the recap. We'll
Exactly.
follow. Are you
Not
following?
only recap, even the understanding. Are you understanding me? You are following
Understand
me?
condition, yes. And also if the
Yeah.
patient understands his condition, you mean the patient is full capacity. If the patient
Yes.
say like
Try
But
to do
as
something called verbal feedback. If you
yes.
offered him something, ask him, what do you think? Is it acceptable for you? Did you find it making sense for you? Is this option a valid option for you? فمجرد الagreement with disagreement كمان هذا other things other than the repetition،
Yeah,
other
exactly.
than following. فأنا مثلا I'm offering the treatment. We can change the schedule, make it more easy for you to follow. What do you think? Is it making sense? Do you feel now you can take the medication? Oh yes doctor، والله options which you are offering me now are good. Okay, agreeing disagreeing with you اللي اسمه verbal feedback، جزء من patient he's communicating back his decision. Yes I want, no I don't want. تمام؟ فالverbal feedback, are you able to follow with me? Can you please repeat how much you got from our conversation؟ كلياتها steps حتعوضك إذا ما قدرتي تسألي عن orientation بالintroduction.
Yes, okay. شكرا.
Yeah, thank you, Dr. Hind. Thank you, Dr. Rasha. I think it's clear now, Dr. Rasha, right? Again,
Yes.
if you remember the definition of autonomy, one of the patient right, autonomy, he has to know about his condition, to share with you, to understand, and at the end to decide about his management plan. So what we are doing, it's the practical issue. What we are discussing with the patient, the decision, the procedure, all related to the practice and including the mental or the capacity of the patient. So never ever the patient will decide about something unless he's able to understand and to share and to decide at the end. This is the meaning of and the definition of the autonomy. Thank you, Dr. Rasha again, Dr. Marwa, Dr. Hind, everyone. chatting and attending. We'll see you, inshallah, with the short clinical day, maybe in the Thursday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.